This is a part 2 video of the knee joint. Here we are going to see the important relations. The most important semilunar cartilages or menisci. So relations anteriorly you are having the prepatellar bursa. So here I show it. And this is the right. Anteriorly you have the prepatellar bursa and the expansion of the retinaculum. Vastus lateralis forms the lateral retinaculum. Lateral retinaculum. Vastus medialis forms the medial retinaculum, right? So this is about the retinacula and the prepatellar bursa. This is about the anterior, and posteriorly you have the popliteal fossa. So what do you have? Popliteal vessels and tibial nerve, common peroneal nerve, great saphenous vein, everything is going posteriorly, and laterally you have the biceps femoris tendon. Laterally you have the biceps femoris tendon. That's all about the relations. And now we are moving to the semilunar cartilage and menisci. This is a separate short note for you. So for that you should know that there are two menisci. Give me this, can you see this lateral menisci and the medial menisci? So first point you are supposed to write is, this is a fibrocartilage and it acts like a cushion, and the periphery of the cartilage is thick and the center of the cartilage is thin. So upper surface of the cartilage is concave, right? And cartilage is concave and the lower surface is flat, and it is connected with the coronary ligaments to the capsule of the knee joint. Understood? There are 5 points I have told you. Number 1 is the shape. Number 2, the superior surface is concave and the posterior or the lower part is flat. And the next is like a cushion, and it is fibrocartilage. That is the most important point. And you have the lateral semicircular cartilage, which is circular in outline, and it is smaller than the medial, and the posterior ends are attached to the tubercle of the intercondyle. At least the students should write intercondylar, in between the condyle, intercondylar eminence. And during the terminal phase of extension of the knee joint, when you extend your knee joint, the femur rotates. The lateral condyle slides anteriorly. The condyle of the lateral condyle slides anteriorly, and it gets fixed to the lateral meniscus. This is called as locking of the knee. The periphery of the lateral semilunar cartilage is separated from the popliteal tendon by a bursa. The tendon is also coming over here. It is separated from this by a bursa, and it gives attachment to the meniscofemoral ligament. That and all we have already seen. So at least you should write as what is the shape of it, and what is meniscofemoral ligament is attached posteriorly, and anteriorly you have the coronary ligament, which is attached to the capsule of the knee joint. And next one is the popliteal tendon is related to that. Few of the popliteal muscle is getting inserted into the the lateral menisci. Finished. And then I'll move on to the medial menisci. This is all C-shaped cartilage. This is circular and this is C-shaped. Look at the difference. It is very large, and anterior horn and posterior horn are there. They are attached to the intercondylar eminence, and the structures attached to the medial semilunar cartilages are: number 1 is the tibial. This side you have the ligament, tibial collateral ligament. This side it is not attached to the fibular collateral ligament because your popliteal tendon is crossing here. So behind that only you have the fibular collateral ligament. So but here it is tightly attached to the tibial collateral ligament and the coronary ligaments. So it is more prone for injury. The movements are restricted due to the ligamentous attachment, so liable for injury. Very important point you have tried. This side it is not attached to the fibular collateral ligament, but this side it is attached to the tibial collateral ligament, right? And sometimes the meniscus is trapped and crushed by the medial condyle of the femur, and it causes the bucket handle tear of the menisci. And then next is the synovial membrane. We move on to the synovial membrane. Synovial membrane is here nicely you can see. Just it lines only the outer border, and then it goes inside, and it comes out like this. Understood? So you can see the menisci which is inside the capsule, and the synovial membrane is attached along the borders of the patella, right? And the menisci is not covered by because it goes like this. So the synovial membrane doesn't enclose the menisci. So that's why it is called as intracapsular and extrasynovial, right? And this is about the synovial membrane. And only the articular genu part of the muscle is alone attached here because it is communicated. Sorry. Articular genu is a muscle which is present here. So I said already it is communicated with the knee joint. So only that part alone is affected. And then next is the from the posterior surface, bursa around the, we will move on to the bursa around knee joint. So here you will be having the patella. Above the patella you have the bursa called pre-patellar bursa. This is patella, and this above, in front of that, it is called pre-patellar bursa. Here it is called superficial infrapatellar bursa, and behind the ligamentum patellae it is deep infrapatellar bursa. So already we have enumerated above the patella. Patella is here. Above the patella it is called suprapatellar bursa. In front it is called pre-patellar bursa. Below you have the ligamentum patellae. It is called superficial infrapatellar bursa, and it is deep, behind that it is deep infrapatellar bursa. And then so 4 bursa are here, right? These are called anterior bursa. So suprapatellar bursa, pre-patellar bursa, superficial infrapatellar bursa, deep infrapatellar bursa. Next is the posterior bursa. It lies between the two heads of gastrocnemius muscle. So 2 bursa are here. And then medially you will be having the bursa anserine. What is bursa anserine? Your sartorius, gracilis, semitendinosus, 3 gyrox muscle. Sartorius, gracilis, semitendinosus. 3 muscles are inserted in the medial, just below the medial condyle of the femur, the tibia. That area you have the bursa called bursa anserine. Anserine means like a bird's foot. These 3 tendons are getting inserted. On either side of the insertion of the semimembranosus, you have a bursa. So totally there are 3 plus the 2 bursa. One is here, one is here. And then laterally you have between the biceps femoris tendon and the popliteus, you will be having 1 bursa. Between the tendon of the biceps tendon and the lateral ligament of the knee joint, it means fibular collateral ligament, you have a bursa. Between the lateral ligament and the tendon of popliteus, you have a bursa. Beneath the tendon of the popliteus, 1 more bursa. Okay, so there are 3 bursa here in the lateral part. So this is about the bursa. You will get 3 marks for the bursa. And the movements of the knee joint, you have the flexion and the extension. Flexion is by, you know very well, posterior compartment muscles only causes flexion. So biceps femoris, semitendinosus, semimembranosus. Extension, anterior compartment, that is your quadriceps femoris. And then next is blood supply. Blood supply, you have to write about the anastomosis around knee joint. Anastomosis, how will you write? Only 4 arteries. Genicular arteries you have to write. So what are the genicular arteries, you know? So femoral artery, you know. Popliteal artery, you know. So femoral artery you have to write. Okay, femoral artery. Descending genicular branch of the femoral artery you have to write. And the same thing for the popliteal artery also, genicular branches of the popliteal artery, and anterior and posterior tibial arteries recurrent branch. So these are the blood supply. And nerve supply is femoral nerve and genicular branches of the common peroneal nerve, genicular branches of the tibial nerve, and genicular branches of the operator nerve. Who are all nearby, you have to write everything. And then clinical application is violent movement called sprain and tears of the menisci. Which menisci is more prone for injury? Medial menisci, because it is attached to the tibial collateral ligament. Lateral menisci escapes because of the tendon of popliteus. Osteoarthritis, second clinical application. Meniscal tear, osteoarthritis. And then third is your housemaid's knee. Housemaid's knee means housemaid, when they mop the floor, it causes inflammation of the pre-patellar bursitis. Housemaid prepares. So like that you keep it in mind. Pre-patellar bursitis. Pre-patellar bursitis. Don't forget, it's a very important MCQ. Housemaid means she prepares. Keep it in mind like that. And then fourth is clergyman's knee. Clergyman's knee. Like fathers, they kneel down and they pray for us. So what will happen? That causes infrapatellar bursitis. Okay. So very important, superficial infrapatellar bursitis is clergyman's knee, very important MCQ. And the last one is genu varum or genu valgum. Genu varum means knock knee, and genu valgum means both the knee joints are away. So this is about the knee joint essay. So if you have any doubts in that, kindly do ask me in the comments.